500 marks and you require to get a minimum of B, which is a high score, to be able to ace this exam. But no, she is not your examiner.
Because when the sun shines, we shine together. Told you I'll be here for.
Hello guys, you're welcome back to Nursing with Eunice. Let's talk about OET speaking. It is surprising to know that some people failed OET because of speaking. They passed the other modules, meaning that what is your strength could be other people's challenges. So have you got problems with OET speaking? I'm going to give you a few tips that could help you ace this part of the OET exam, because it is as important as the other parts of the test: the writing, the reading, and the listening. Speaking is also 500 marks and you require to get a minimum of B, which is a high score, to be able to ace this exam. One of the things you need to do during this exam is you need to well compose yourself. Remember, you are a professional in your chosen field, be it a doctor, a pharmacist, a physiotherapist, a nurse. You are a professional and you should speak in that language, in that tone, as a professional. Now, it will be like an interview or a discussion with the patient where your interlocutor will expect you to initiate a conversation. It may seem daunting to initiate a conversation because in your mind, in your mental frame, you are saying the interlocutor, ask your examiner. But no, she is not your examiner. She's just there to play a role, to act as a role play. She's just there for the role play. So don't look at her as your examiner. Look at her as your patient and respect her the way you would a patient and not an examiner. So you want to initiate conversation, you want to maintain the conversation, and you want to conclude the conversation nicely. How do you do this? Number one tip is that you want to engage in positive tone. You don't want to talk down on your patient. You want to maintain positive tone. You want to explain your procedures in details. For example, the patient is telling you, oh, I have fever. They've told me I should do a urine test. I don't know how to get the sample. You want to explain step by step how the sample will be collected and discount for your mark. You want to use flowery language. You want to use different pattern of sentences, simple sentences, complex sentences, compound sentences. All of this will showcase that, yes, you have a good control of the language and you are able to show this in your expertise when you are working. It is a good thing you've chosen to do the OET exam because this will actually help you professionally when you get to start practicing. You also want to listen and respond. Your interlocutor, which is the person doing the role play, will ask you questions. Oh, but what? Am I going to die? I was told I have cancer. You don't want to ignore that question. You want to you want to listen to that question and you want to respond. Responding to that question, how you respond to that question will actually tell if you understand the situation and if you have put yourself in that situation. You want to recognize the patient feeling and allow them to feel what they feel, not tell them how they should feel. I'll be doing another video which will be more detailed about speaking, but these are just items of tips that could actually help you in the OET speaking. You also need to offer advice. As a professional, a patient cannot come to you and tell you, oh, I've got cancer, I am not able to eat, I'm not able to drink, and I feel I'm dying. And you just tell them, oh, just take your medication and then they go. You need to give them practical advice. You need to make them understand why the advice would work. You need to flow, make it like a real setting, and you'll come to see that all of this will improve your overall score. And I don't want you to panic. I want you to be relaxed. You could use, when you're making advice, you could use words like, I highly recommend that. It is important that. It would be a good idea too. I strongly suggest that. My advice is for you to. You start your words like this and you come to see how far this takes you. And it will really put you at ease and it will put you in the place you are, a professional in that conversation. I hope you get what I'm talking about. Good. Now let's move on to the next one. You want to finalize by summarizing. So what have we talked about? Okay. Mrs. James, let me just review what we have discussed today. Firstly, you told me you were feeling a lot of pain in your right shoulder. I could not see anything wrong myself, so I'm referring you to the X-ray department and they will be able to tell you if there is a fracture. Once that is done, they'll send you right back to me and we can discuss the next steps. What are you doing? You've You've stated the problem, you've stated what you understand by the situation, you've stated that you're not sure of some certain part, you've stated you're going to do some investigation, you've concluded by saying there will be a review, and that encapsulated the whole thing and made the discussion to make real sense. So you're going to have two scenarios which you really cannot tell which scenario you will have. So you want to practice as much as you can, because when you are speaking, you don't want to go in a negative pathway. You want to make sure that your statements are positive, but not falsely reassuring the patient. You get what I mean? And you also want to try to speak more. Some people are speaking, maybe they are very slow in their speech. That is not a problem. Even if you are slow in speaking, does not mean you cannot pass OET exam. You still can pass OET exam, but you just need to like be focused in what you say. The fact that you are slow in speaking does not mean you're not speaking sense. So be consistent in what you're saying, and what you're saying should make sense. That is what matters. I know fluency counts in your mark, but it doesn't matter even if you are a slow speaker. If your line of thought makes sense, you get your mark. And if you are a fast speaker, try not to be too fast, such that the person listening to you can really understand what you're saying. Just try to like maintain a borderline, so that you're not too fast and you're not too slow. And the bottom line is that they should be able to understand what you are saying. I hope these few tips helps. Until I see you again in my OET video series, I hope you'll be able to, if you need to replay this video again, please replay it. Practice, practice, practice. You could get somebody to practice with and then see how well you have improved. Mark yourself using the marking criteria on the internet. I highly recommend Benchmark. They are really very good. And going through their free session could actually help you ace this exam. I don't want you to fail OET because of speaking. You can do it. If you believe you can do it, and with hard work, preparation, when preparation meet opportunity, what is the result? Like we always say, it's success. So your success is sure. Have you subscribed to the channel? Subscribing to this channel is one way of moving it forward, and is also one way of encouraging me. Watching these videos to the end is also another way of making the views count. Thank you so much for watching to this point. I really appreciate you. Until I see you in my next OET series, bye for now.